Good day, doctor. Okay, clinical tip number, I think it's about 302. And this one is about tooth raincoats, rubber dams. I know many of you don't use rubber dams on a routine basis. I still do when I do pediatric restorative. Why? I love what the rubber dam can do for me. I want you to think about this for a minute, because it is true that if you don't practice, hey, it's dental practice, remember? If you don't practice the rubber dam technique, it can be a real pain in the neck. But if you practice it, number one, you can set up the hole ahead of time. You can place the clamp ahead of time. You can be sure and put your floss on the clamp. You can have the rubber dam on the wings. You can have the frame on it. And then in one fell swoop, you put your little forceps on the clamp, spread it a bit, carry the whole rubber dam to the tooth, place it on the tooth, press apically a bit, let go with the forceps, remove that, kind of fix the rubber dam the way you want it. Then I pop it off the wings and stretch it from about the molar to the canine or the D, whatever you have there. Why? I don't want to punch individual holes. Now that is a pain in the neck, and sometimes they get in the way. So I just stretch it. Now what have I done? I have given myself isolation that keeps the saliva and the tongue out of my area. I've created my working area, which is separate and distinct now for my situation from the patient's area, which is the rest of their mouth. And I have also given the patient the sense that I'm working somewhere that's not as connected to them. I know that sounds funny, but it's true. It's isolating me from them from me. Our spaces are our own. We each have our little spaces. Keeping the tongue out of the area is a good thing, of course. Keeping the lips out of the area, keeping the saliva out of the area. All of that's great. I also find that when I place it, one of the first things that moms who are always sitting beside me are doing is going, can he breathe? Okay, just pick up the rubber dam on the opposite upper corner, more or less area, from where you have the clamp. Hold it up, have your assistant cut and make a small hole. And you say, whoop, now we have a breathing hole. Now, doctor, you and I both know that there's breathing space under the frame right there. But the mother doesn't see it, and she's busy panicking because she's already scared about everything for her child. So make a breathing hole. You can't imagine the peace it gives the mother. Of course, we're saying to the child, now you have a breathing hole, so no problem getting your breath. But the reality is the child wasn't worrying to begin with, except that they didn't like the whole thing. All right? But mommy feels better, and the child can breathe very, very well, no matter what. That's another thing to do. I also am always using a Molt mouth prop, not a Molt ratchet type mouth prop, not a big rubber bite block, because that thing gets in the way. If you put that in, the tongue has about half of the oral cavity to be in. So the tongue already is fighting. The Molt is much lower profile for the tongue and much nicer for you, and can be held by your head support person, drawing it sort of posteriorly at the patient's head and holding it in place. So that's a good thing. So now you've got a raincoat, you've got isolation, you can work quickly, you can work well. I tell you what, if you practice, you'll get good at it, and you wouldn't want to work without it. It's worth that extra couple of minutes to put it on and have it there, because your whole procedure goes better. Let me give you one more bit of advice in this clinical tip, number 302, and that is you would use a 208 clamp for a primary molar, a 201 clamp for most 6-year molars that are erupted pretty well, and then you need only 2 more clamps in your armamentarium, an 8A and a 14A for any molars that are partially erupted, usually 8A, sometimes 14A. That's it. I keep those clamps in my ops kit, but I'm almost always using a 201 or a 208, which are very gentle, easy to place, slightly inverted clamps that hold beautifully on the tooth as long as it's erupted enough. There's your clinical tip number 302. You have a good day. I love you. Signing off.